Welcome to Masterclass number 6, entitled Prepare, Activate, Engage, a 21st Century Checklist for Appointments. Our guest today is Dr. Laura Geyer. In this class, we will discuss the 21st Century Patient-Provider Dyad and how this dyad assigns new roles to each party. We will highlight satisfaction with the process and how experience of care requires new skills to successfully navigate multiple complex health systems. This includes patient activation and patient engagement, which are two evidence-based constructs associated with high-value care. It also integrates patients who prepare for appointments with providers and are activated to manage their care and engage throughout their appointment. This, in turn, leads to better health outcomes, fewer errors, and greater satisfaction with their encounter. Dr. Geyer.
Thank you, Jacinda. So good to be here with you.
Thank you.
So I have a couple of learning goals for this presentation. The first is that upon conclusion of this class today, everyone who joins us should be able to explain why patients and providers need different knowledge, attitudes, and skills to manage their health in the 21st century. Second, we want to be able to describe the evidence-based constructs that you just introduced in the introduction here. Patient satisfaction is intimately involved with both of those constructs. We also, for number 3 of our learning goals, we want to be able to predict how patients and providers who prepare, activate, and engage with one another will evaluate their satisfaction and their experiences with one another. So an exciting topic to discuss.
I think that's fantastic because as a dietitian, I always felt that the patient was the most important member of the healthcare team.
I did too. So we're both registered dietitians and nutritionists, so we've had very similar training. I'm going to share a quote with you that I think is really important. The good physician or dietitian or nurse treats the disease, but the great one treats the patient who has the disease. And that's by the father of modern medicine, Sir William Osler. So, when I came across that quote, and I did years ago, I really held it in my memory as kind of something to help me remember that it's a person, but it's also the condition that we're working with. In the 20th century, it wasn't so long ago, and most of us were born in the 20th century, right? But it was a very different century. And as I think about the first 25 years of the 21st century, hard to believe that we are a quarter of the way into this century already. There have been just unimaginable changes in life and in the world. But let's go back to the 20th century. 20th century in terms of relationships with providers and patients, characterized by trust. The patient trusted the physician. Often the physician knew the patient and their family, often was a member of the community that the patient belonged to. The patient would call the physician and knew their doctor, usually as a male. We didn't have as many women in practice in the 20th century. It was a long-term relationship that was developed and expected in the 20th century. The goal of healthcare was to initially increase longevity in the first half of the century because sanitation and management of communicable disease was something that we focused on for the first 50 years. The payment system was very different than what we are moving into today and experiencing. Because fee for service, I come to see you, you provide a service, and I pay you. Today, the emphasis is on quality and outcomes. Communication was much simpler in the 50th century, although I'll be honest, it's more complicated today. It is much more efficient, however. Yeah. So communication, made a phone call to make an appointment. All of the patient's records were written down. I don't know about you. It was difficult to read some handwriting. I won't make bad jokes about handwriting, but you probably remember trying to go through physical medical charts with paper inside with information about the patient. how do we learn about health? Well, we had radio, we had television, we had newspapers until the latter part of the 20th century. And again, patients had very limited, if any, access to their personal health information. But in the 20th century, okay, we also recognize that we've seen more generations that have been born. Okay, so the silent generation from 1925 until 1945, followed by the baby boomers, the big generation now that is really has dominated the workforce, dominated policy in this nation, and is now starting and has been retiring, so exiting the workforce, followed by Gen X and then Gen Y and then Gen Z. Probably didn't know there were all those alphabets. The millennials are also Gen Y. So you can also think of Gen X, then the millennial generation, then Gen Z, and now we have Generation Alpha. So we are moving into the Greek alphabet now.
And we all think different, don't we? So different.
So differently. And the reason I've included that information in this presentation as we talk about change is because as we interact with patients from different generations, we want to remember that the membership in their generation has had a significant influence on their attitudes and their values and their expectations of health providers. And what does good healthcare look like? So it's important to keep that in mind, with this caveat that every person in every generation isn't the same, right? So we don't want to create stereotypes. And when we work with someone from the silent generation, think, oh, well, they're not going to be, or baby boomers, oh, they're not going to have the technical skills. That's really not very accurate. And people who are baby boomers are in their 70s, at least the first part of that generation. So to say that baby boomers, older people, I just want people to think about some of the statements that they make about their patients. Oh, I've older patients, older people. They're not always technology illiterate, right? The next slide I'm going to look at here takes a look at the doctor-patient relationship. Earlier in the 20th century, we didn't have as many professions as we have today. Our dietetics profession was just getting started. We didn't have PAs until the middle of the 1960s. And there are other professions that have come along and some that have just really grown into managing a very different scope of practice. When I look at pharmacy today, we're giving vaccinations, so scope of practice for many.
And they're a nurse practitioner.
Who practice independently.
Right. Who practice independently.
Right. So again, looking at this table, it's looking at the doctor-patient relationship because that's really what there was at the early part of the 20th century. But today, we have many different providers that can provide us with primary care, for example. So, the patient expectations, and this is a quote that I thought was too rich, I didn't even want to paraphrase it. Patient expectations in healthcare continue to increase. And this is something that needs to be managed adequately in order to improve outcomes and decrease liability. As much as 70% of litigation relates to real or perceived problems involving physician communications. Again, this article was written by a physician, so she's focusing on physicians, but I would say any kind of healthcare communications, they aren't as clear as they could be, and we need to do a better job.
Such as communication with medications. How to take them, right?
Exactly. So here are the expectations that we're seeing in the 21st century, at least first quarter. Trust is still very important. But what else do people want from their providers? They want to make sure that they feel confident because of their knowledge, that they are available and accessible. I know in my community, we have an academic medical center. You would think, oh, we've got physicians, so many different kinds of physicians. Do you know that when you are a new patient, it takes 4 months to get in to see somebody? So if you're really sick, what do you do? So really, people expect and want to be able to access their providers, especially when they need them. They also want providers who are going to ask them about their values and their expectations of what's taking place in the interaction. They want providers who listen actively and who they can tell aren't just, nodding, but really tracking along with them. They want to see and feel demonstrated empathy, respect, and commitment. They want to share decision making. They want care coordination if something needs to be managed extra, the visit. That includes not only themselves, but perhaps family members. And if a family member needs some care coordinated, they want to be involved with that. That's very different. And where does HIPAA allow the family to get involved? So, we need to get those permissions and ask, who else can be involved with your care? Something else.
And that helps to build trust.
Oh my gosh. And again, trust is still.
Yeah, it makes patients realize that the provider truly cares about them.
And right. And if it's a family member that, they care about their family member too.
Yeah.
I agree with you. Here's a big one. People today have access to a lot of information. Okay. It's an overload in some instances. And the general public doesn't know how to sort through what's reliable and what's not reliable. So they want their providers to provide adequate information about clinical information, with adequate explanations that they can understand. They want to understand how to manage their health. They also want the prognostic information. Hey, what do you think is going to happen here? To the best of your ability, something realistic. But again, so that people can plan and live their lives and know how to manage all of that. And they want better communication. They also want better education from their providers. And there are some professions that do not give any kind of written handout to their patients about whatever, whether they're there for therapy or they're there for, diagnostic purposes. There are some health professions that are very weak in their communication skills, both in terms of oral, but written and giving patients information they can take home to remind them about what to do. Here's something. The physician is no longer the sole provider of healthcare. So we have many other individuals who are sharing the responsibility, and we have scopes of practice that have expanded. So how can we connect with our patients so that we empower them? And that's with all of the information that's available with shared responsibilities, more people doing similar kinds of work. Today in the 21st century, people want to be empowered. And so there are some specific things that we can do differently. And there are 2 new constructs that have been researched and published about in the last 20 years that especially those providers who are in practice, but students may be in a curriculum that hasn't included some of this information. So these 2 constructs, one of them is patient engagement and the other is patient activation. I don't know in public health, in the work that you do, if these are 2 constructs that you have ever read about or that you're familiar with. They're evidence-based, so there's been a lot of research, and both of these constructs actually have an assessment tool that you can use to determine or estimate, well, how activated is my patient? How engaged is my patient? So that's nice to have kind of some guidelines. Okay, so if you want to help build some skills, you know where to start.
Yes. And then it will tell you, identify any deficits that you really have to hone on.
Right, because those will be areas where people have lower scores.
Right.
So let me define them for you so you know what they are. So, and the audience, the patient engagement involves patient activation. So it's a much broader term. It describes patients who are involved with their care decisions and with the process of care. So that's someone who's engaged. You and I are engaged. We are having a conversation. You're nodding, but you're tracking and you're actively listening. And that's what patient engagement looks at. Greater engagement is demonstrated by communication effectiveness and by participating in informed consent. Not you just nod to it like in the past, but you dig into the words and you really understand what you are consenting to.
Maybe ask a few questions.
Exactly. In fact, if people don't ask questions, that should be a clue that they don't understand or that they aren't engaged. Right. People also want to be sharing decision making. They want to self advocate, and they do. And when they do all of this and are more engaged, they have better health. There is a research validated tool, and it's called the Patient Health Engagement Scale. Now, let's transition and talk about patient activation. What is that? So, that's something slightly different. It's the patient's willingness to take independent action to manage their health. The reason they do that is because they have the knowledge and the skills and the confidence to do so. So greater activation improves your health. The research validated tool is called the PAM Patient Activation Measure. I think the first PAM had 22 questions. I'm going to show the questions on the PAM 13 question. What you get when you complete the tool is an activation level 1 to 4. So we're going to look at that in just a second. All right, let's talk about what engaged patients look like. There are some characteristics that you can look for. Engaged patients are going to seek active participation, in their care. They're going to share decision-making. They are going to communicate their needs. They're going to discuss and describe their symptoms. So there's that level of awareness. They're going to explain their preferences because they have them. They're going to ask questions. A patient who has no questions is a patient you need to be concerned about for many different reasons. It could be low literacy. It could be low health literacy. In this case, it could be low engagement. We're going to find the same thing with low patient activation. We know that engaged patients make commitments to following the prescribed treatment plans, and they do follow them. They don't just talk. They are proactive with regard to their health. They take care of themselves. So their self-care habits are very good. They assume responsibility for their health decisions. So they know that they're the ones ultimately responsible. The doctor isn't in charge of my care. That's not the doctor's responsibility. The doctor's responsibility is to diagnose and treat illness, right? And so the doctor is there also to prescribe medication, to develop a care plan, share decision making with me so that it's going to be a plan I can follow, but I'm the person responsible for my health. And see, that's a real paradigm shift from the 20th century where there was more of a patriarchal, authoritarian physician in charge who told you what to do, right? This is what you do. Exactly. Something else that we find with engaged patients is that they demonstrate empathy, respect, humility when they interact with other members of the office and other members of the healthcare team, and that they successfully manage stress and their emotions. Because life doesn't always go well when you have a chronic illness to manage. It's not always going to go well. And they're able to face bad news with a positive outlook. Not to say it may not falter, but overall, they're able to rally and maintain that positive outlook. Engaged patients are activated to be prepared for appointments, and they show up on time. Shared decision-making is an evidence-based tool available on the AHRQ, Agency for Healthcare Research and Quality. Shared decision-making is something we want to find not only in public health, but also in all of our health professions. The SHARE model that is on the website is an evidence-based model. Really, shared decision-making, certainly it is a set of skills. I like to think that, though, more of an attitude of practice, because you're not comfortable as a provider with that partner joining you to make the decision, right? Because, again, it is a partnership when you're providing care to somebody. Shared decision-making helps you determine the nature of the problem your patient's experiencing. So that's why, again, it's really valuable because you're getting information from your patient about their values and their expectations that you can help incorporate into decisions. And what I like is there are a couple of examples on this website. I'm going to just share two of them out loud. So in the 20th century, we may have said to patients something like this: based on your numbers and your symptoms, I would recommend 20th century approach. 21st century, it's very different. Jacinda, I'm happy to make a recommendation to you. But before I do, can you help me understand what's really important to you? We're going to have to reduce your intake concentrated carbohydrate. So let's find out what's important to you about the way that you socialize and what your dynamics are like, right?
So you get a better picture of the patient.
Absolutely. So as we transition now into patient activation, here's what we're finding some very interesting statistics in the research. So when less activated patients are compared to those who are more activated, we find that less activated patients are 3 times more likely to have unmet medical needs. They may be undiagnosed. They may not have ever been discussed. They're also twice as likely to delay medical care. Highly activated patients, when compared to those with less activation, are 2 or more times more prepared with questions when they visit their physicians and providers. They know and understand the treatments that they are participating in and receiving. They seek guidelines for their conditions, and they seek out health information. They do research. They also know something about the providers, the quality of their care. So they really are informed. This next slide shows the 4 levels of patient activation, levels 1 through 4. And least activated is level 1, most activated is level 4. So a description at level 1 is that the patient feels disengaged and overwhelmed. Level 2, you can see the progression here. Level 2, they are becoming aware, but they're still struggling. By the time they get to level 3, okay, because we're helping them to build skills, we're giving them information, they are taking control and action. And then by the time they reach level 4, they are maintaining their behaviors and pushing even further.
So their confidence level rises a lot. Absolutely.
You may be wondering, well, kind of what % of the U.S. population do we maybe see at each level of activation? So I have the results of a study here that estimated about 41% of Americans are activated. Most activated, highest level, level 4. At level 3, pretty good amount too, about 37%. So together, we've got about 3/4 of the population there. Level 2 is about 15%, and level 1 about 7%. So we have some work to do. Something that I know because I do work with literacy and health literacy is that those percentages of population at the lower levels compare very favorably to those with low health literacy and low literacy skills as well.
Right. Totally.
Because if you don't have literacy skills, you can't do the research and the reading, and you hear two words exactly can't ask questions. So I'm now looking at the 13 questions on the patient activation measure. I'm just going to share a couple of them with you so you know what they sound like. So I am the person who is responsible for taking care of my health. See, I'm in charge, not my provider. Here's another one. I am confident that I can tell whether I need to go to the doctor or whether I can take care of this myself. I know when my first son was born, his pediatrician gave all new parents a handbook. It was just a paper, what does it mean when the temperature, is above normal? When do you need to call me? And he had that kind of information all throughout with very practical tips for new parents. And it built such confidence in me to know this is what I do, this is what I look for, and this is when I call. So it's easy for providers in simple ways to help build these skills and confidence in their patients. Here's another one. I've been able to maintain lifestyle changes like healthy eating or exercising. Well, that's positive. That's someone who's highly activated. They are in charge and they are taking care of their health. So now let's put it all together and see what that might look like, okay? So if we want our patients to be prepared and activated and engaged, here's what we do. These next few slides, I have taken all of this information and assembled it as a handout to accompany this presentation. And it's no more than 2 sides, and providers can freely make copies of this handout and give it to their patients following completion of this masterclass. Okay, so I hope that's good news for all of you providers. And for the students who are in training, I'm going to urge you to keep a copy of this information maybe in a file that you have, and think of it as something that you'll put into practice when you are in practice. So, for example, my suggestion is to ask your patients to have a notebook. They can have electronic file if they, don't want to handle paper, but someplace dedicate some source to keep all of their medical information together. The reason you want to have a notebook or something similar is because there are 5 steps to take for every appointment to be prepared. So here's the prepare part. Number 1, create a list and write down all your questions. Write them down, between appointments. Don't wait until the day before and try to remember all your questions. But as a question comes up, just go ahead to your notebook, your medical notebook, and write it down. Number 2, they want to describe the changes in life or their health condition that are interfering with their usual routine. They want to identify those barriers to the care plan that they share decision-making with at the last appointment. They want to make a list of all of their medications, whether they are prescribed, whether they're over the counter. Here's something we don't think about. Medications over the internet. We need to make sure we have a complete list for our providers. We also need to make sure we tell them the dosage, frequency that we take these medications to. We want to bring records from other providers if we've had to go to an urgent care center or see somebody, physical therapist in between. And if we have special needs for language assistance, or perhaps we have a disability, we want to make sure that the office is notified in advance, just as a reminder, so that if they need to get an interpreter, that they have time to do so.
It would be great to keep this in the notes section of your phone, too.
Perfect. Z, you can do it electronically, and whatever format is more comfortable, that's what you want to do. But you want to keep it in writing for yourself, is the point. Now, during the appointment, this is how we are activated and engaged, right? We want to ask questions. We want to use active listening, okay, so that we track along. We want to ask providers to explain the terms we don't understand. And I've given some sample questions that people can use as if they want to adopt these for themselves, like, I don't understand that medical word. Would you please explain it using different words? Different terms? Or could you clarify what you just said using everyday words? See, nobody's going to be offended if you ask a question like that. And this is a nice, simple script that can be given to patients so that they ask the provider who gives the scripts to them, but also to other providers.
And I know when I was in practice, I was amazed by how many patients didn't understand what their diagnosis was. Like, they could tell me they have diabetes,
right?
They couldn't tell me what was the problem,
right? Exactly. Something else we want to do during the appointment, we want to answer questions completely and honestly. Don't hold back. We want to take notes. Now, that's something we don't even think about doing, right? But here you are, you're paying a lot of money for this, and it's impacting your life in very important ways. Why wouldn't you take some notes? You want to ask about medications. You want to ask about lab tests. Anything that's ordered or prescribed, you want to make sure you ask the questions to give you the information. You want to ask for guidelines, preferably in writing, about finding current and accurate information about health. And I've given on the tips sheet that I've prepared a couple of places, websites that people can visit. You also want to ask for written information about your health conditions. And you want to ask for steps that you can take before you leave. So here you are, you're at the end of the appointment. So doctor or your physical therapist or speech pathologist, what steps can I take in addition to this care plan, okay, that we've put together? What else can I do to improve my health? So we want to build health and media literacy in our patients. And there are some reliable places that we can go on the internet to get information that's accurate, up to date, and again, by the experts. Medline Plus is a resource that a lot of people are not familiar with. The Centers for Disease Control and Prevention, Food and Drug Administration, National Institutes of Health. I think we should teach them how to evaluate websites. The extension of the address. So if it's a .edu or a .gov, then we know that's reliable information. If it's a .net or a .com for commercial, maybe trying to sell you something. A .org, well, it could be a professional organization like the Academy of Nutrition and Dietetics, but it also could be an organization that's more commercial. So you have to use that one with a little bit of caution. You can also evaluate the content of information using the CRAP test. Have you ever heard of that? I have not heard of that. So is it current? Is it relevant? Who's the authority? Or the credentials, basically. The accuracy of the information, and what is the purpose? Is it for sales or open endorsement? All right. Now, Medline Plus also has a handout very similar to the CRAP test, but it has more that you can check for. And I've given links that people can visit the site and take a look at the information. Again, it could be valuable to give this as a handout to your patients. You also want to remember to communicate with providers through the patient portal. That's how you stay activated and engaged with your care. And if your provider gave you an after-visit summary, AVS, summarizing the visit, summarizing the plan, that you're going to follow, go ahead and print a copy. Maybe they'll give you a printed copy when you leave. Make notes on it. What worked? Where did you encounter problems with what was planned? And if you can give some examples, then that'll be helpful for shared decision-making in the next appointment. So here are the final thoughts. Many aspects of the patient-provider relationship have changed, and they will continue to change, right? Trust, however, is still the defining characteristic of that relationship. Knowing what your patients want and expect is really an important starting point. Knowing how to activate and empower them builds on that information, right? And that's what you want to have and where you want to go in the 20th century. You can use these new evidence-based constructs of patient activation and patient engagement to build knowledge, skills, and confidence in your patients so that they can safely and successfully manage their health. That really is the goal of healthcare. I used to tell my patients, maybe you did when you were in practice, I'm not going home with you. It's really important that you understand this diabetic exchange system so that you know how it works when you get home tomorrow morning. And it can prevent complications in the future. Absolutely. Absolutely. So again, I prepared a handout. It's called Tips to Help You Prepare, Activate, Engage. So it makes it real simple. And if people have questions, I hope that they contact me. I provided my name and contact information at the end of the presentation.
Thank you so much, Laura. This is great information.
I'm hoping it's great information, new information probably for our current providers and for students. The more that you can activate and engage with your patients and teach them how, tell them that you want them to engage. There are some people who think it's disrespectful to engage and ask questions. So let them know that this is what you want in your practice and as students in your future practices. This is the end of this master class, and I hope that you're going to join me for the next one. In that master class, we're going to be talking about maternal mental well-being. So at this time, class is dismissed. See you next time.